Hi everybody, I'm starting chapter 14. This is going to be on page 529 is where we'll be starting. This is actually my favorite chapter, and part of that is because I work in radiology and we deal with a lot of musculoskeletal examinations and imaging procedures. So it's also one of my favorite because I just love the way the body moves and how our muscles work together with our bones to allow us to do basic things like walking and jumping. It's really interesting to me. So first thing we're going to do is go over the organs and structures of the musculoskeletal system. The musculoskeletal system consists of muscle, bones, bone marrow, joints, cartilage, tendons, ligaments, and bursae. And the bursae are actually fluid-filled sacs that kind of cushion the joint spaces. The adult human skeleton contains about 206 bones and more than 600 muscles, so it's a very extensive system and lots of moving parts, literally and figuratively. Joints are going to be anywhere that two or more bones meet, and joints typically will contain cartilage and bursae if they are healthy. So the functions of the musculoskeletal system, first thing is movement, posture, joint stability, and heat production. That's our primary function of this musculoskeletal system. The next thing is that it provides a framework for the body. It protects the soft body parts like your heart, your liver, your lungs, and it also stores calcium and produces blood cells in certain areas of your bones. Excuse me. The organs and structures of the musculoskeletal system work together to protect, support, and move the body. And that is pretty much the primary function right here. Protecting, moving, supporting, and heating the body. So if you want to turn to page 529, you can actually look at the bone structure. The musculoskeletal system has different parts. The bones contain many parts as well. The periosteum is going to be the outside layer of your bones. The compact bone is the dense hard layer that's right underneath the periosteum. And the cancellous spongy bone is the little area that's kind of porous or has a lot of different holes in it that looks like a sponge. And that's inside of the bone. And then the endosteum is that membranous lining of the hollow cavity. Your diaphysis is the shaft of the long bone. Any long bone has a diaphysis, and then it also has the epiphysis on either end of the long bone. So long bones typically have diaphysis and two epiphyses. Bone marrow is material that's inside the cavity of all bones. You have two types of bone marrow, the red bone marrow and the yellow. The red bone marrow is going to be thick. It's going to look like blood. It's going to be kind of like blood-like material. It's typically going to be found in your flat bones and the ends of the long bones. And this is where blood cell formation occurs in the bone. The yellow marrow is that soft fatty material that's found in the medullary cavity of long bones. So if we want to look at the medullary cavity, this is the medullary cavity right here. It's the very middle of the bone. Notice how the epiphysis is on either end, and plural is epiphyses. And then the diaphysis is the long shaft or the body of the long bones. This is the spongy bone, one of the layers of bones. You have your compact bone, which is in the shaft area. And then the yellow marrow, notice how it's right here and it kind of is towards the end of the long bone. All right, so we do have lots of skeletal bone as well as bones of the extremities or the joints. So skeletal bones involve the maxilla and the mandible, which are the upper and lower jaw bones. Maxilla right here, mandible right here. Together they form the mouth, and the maxilla forms the bony hard plate of the mouth. Your vertebral column is made up of all the bones that are called vertebrae, plural, AE. Vertebra is singular. And this is the column where the spinal cord runs through. So it protects the spinal cord, it supports the head, and it provides points of attachment for the ribs and the muscles. The vertebral column is broken down into three separate parts. You have your cervical vertebrae, your thoracic vertebrae, and your lumbar vertebrae. The cervical vertebrae are numbered C1 through C7, C for cervical, and they're the first set of 7 bones in your spine that form the neck and also where the skull sits. The thoracic vertebrae are from T1 to T12, so it goes C7, T1, down to T12, and they're the second set of vertebrae that sit in the thoracic portion of the body. This is where your lungs and your heart lie. And then the lumbar vertebrae are the last 5 bones, L1 through L5, and they are the ones that form the inward curve of your spine. Following the lumbar vertebrae is the sacrum, which are 5 vertebrae that have been fused together due to development of the fetus. And then the coccyx is the 4 last vertebrae that make the tailbone, and they're also fused together. Vertebral arches are formed by the lamina. Part of them is formed by the lamina. And if you turn to page 531, you'll actually be able to see all the different portions of the vertebral bones. We also have some more skeletal bones. These are your appendicular, is what we call them, which means your extremity bones. So you have your scapula and your clavicle bones, your sternum, upper extremities, and then the lower extremities, which include the pelvic area as well as the actual lower extremity bones. Notice the numbers for each of these. If you add all of these up together, you get 206 bones. So, bones are held together by joints, and joints are the meeting of two or more bones, and typically they are going to have articular cartilage that covers the surfaces of the joints, and it's made of fibrous tissue, and it allows for smooth movement. It kind of cushions and protects the joints. The meniscus are crescent-shaped cartilages, and these are found in your knee. You probably heard of a lot of people saying, I tore my meniscus. This is one of the types of cartilages that you can find. And then inside your spine, in between each of the vertebrae, intervertebral, between the vertebrae, are discs that are made of cartilaginous material, and they are found in between the vertebra to cushion the vertebra as it's moving. The pubic symphysis is a cartilaginous joint that joins the two pubic bones together. Synovia is fluid that is secreted by the synovial membrane, and it's found in the joint cavities, and this allows for more cushioning. The bursa is the fluid-filled sac that allows for movement of one part of a joint over another. So, for instance, you have bursa in all of your joint spaces, in your shoulder, in your knees, in your hips, and it just allows for smoother movement. Now, ligaments and tendons can be confusing. The ligament is going to be connective tissue that attaches bone to another joint or another bone, and then tendons are connective tissue that attach muscle to bone. Aponeurosis is a strong sheet of tissue that acts as a tendon to attach muscles to bone, and so we'll see that in just a little bit, but it's just a strong sheet of connective tissue. So if we want to look at some joints, here is the knee joint. Remember, the meniscus is like a crescent-shaped cartilaginous pad. You have the synovial membrane, which is kind of like this lining that lines the entire joint space. The synovial cavity is this cavity right here where you'll have synovial fluid. Ligaments, remember, are going to attach bone to joints, and then tendons are going to be attaching muscle to bone. This is a bursa. Remember, that's like a fluid-filled sac, and you'll find this pretty much in any joint space. Excuse me. All right, so we have different categories of muscles. We have striated muscles. These are typically skeletal muscles, and they're going to be attaching bones together by tendons, and they allow for movement. So skeletal muscles are going to produce that action of pulling, walking, lifting. Everything is done because of muscles pulling the bones. And every time you use your muscles, you're actually strengthening your bones. And so working out and lifting weights actually helps your bones get stronger. Another category of bone, muscle is the smooth muscles, which are unstriated, and these are typically found in the internal organs of the body, like your stomach, the walls of your vessels, and they're involuntary, which means we don't have to think about them doing their job. Another category of involuntary muscle is the cardiac muscle, and we've already talked about the cardiac muscle, but it is what forms most of the wall of the heart, and it's what allows for the involuntary contraction of the heartbeats. So there are different types of movements in the body. Bones and muscles work together to produce these movements. Some of these movements are listed here. Abduction and adduction. A good way to remember the difference between these two, and I think a lot of you already know this, is adduction is addition. So you are adding to the body, or you're bringing something back to the body, and then abduction is taking away. Inversion and eversion, extension and flexion, pronation, supination, and rotation. So these are the images that correspond to those movements. So here is abduction is moving away, adduction is moving towards, rotation, just like you rotate your head, inversion and eversion. So inversion is going in, eversion is going out, flexion and extension, and then pronation and supination. Remember prone and supine? So prone is face down, supine is face up. All right, let's look at our combining forms. There's quite a bit in this chapter, but for the most part, they're pretty common. They're pretty common sense when you look at them. So carpo is carpals, or the wrist bones. Clavico and claviculo are clavicle. Costo is going to be the rib. Cranio is your cranium or your skull. Femoro is the femur, which is the upper leg bone. Fibulo is the fibula, which is part of the lower leg. Humero is the humerus. Ilio is the ilium. Ischio is the ischium. Lumbo is the lumbar region of the spine. Mandibulo is the mandible, or the lower jawbone. Maxillo is the maxilla, or the upper jawbone. Sarco is the sacrum. Notice how, actually this is supposed to say sacro, not sarco. Sacro is sacrum. This is misspelled. Aponeuro, that is that sheet that we were talking about that acts as a combining or joining of the muscle to the bone. Arthro is joint. Burso is the bursa or the cavity. Chondro is cartilage. Disco is the intervertebral disc in the spine. Menisco is meniscus, or the crescent shape. Synovio is the synovia, or the synovial membrane. And then teno, tendino, and tendo, these all three are combining forms for the tendons. All right. Ankylo, this is stiff or bent, and you will see this in some of the terminology we'll look at today. Kinesio is motion or movement, so kinesiology is the study of motion and movement. Kypho is a hump. Lamino is a lamina or a thin flat plate. Lordo is bent forward. Myo and myoso are muscle. We also learned myo in another chapter. Myelo is bone marrow. Osteo is bone. Petro is stone. Excuse me. We also learned that litho is another combining form for stone. So now we know that there's also petro. And then scolio is a lateral curve of the spine. So what are these prefixes? Inter, supra, and sim or sin. So I think inter, if we look at it, it really means just between, which it does. Supra is above. And then sim and sin means together or joined. All right, some of the prefixes, or I'm sorry, suffixes that we have in this chapter include asthenia, which is weakness. Desis is surgical fixation or fusion. Physis is growth. Schisis is split or fissure. And trophy is nourishment or development. And I think you guys may have remembered the word atrophy, which is like no growth or development. All right, so in this medical term, symphysis, the prefix means together or joined, surgical fixation or fusion, between or growth. Well, the prefix is sim, and we just learned that sim means together or joined. Physis is the growth of something. So this is joint growth or growing together. And so a pubic symphysis is a growing together of the pubic bones. All right, so let's look at the knee joint. These are 3 x-rays that you will actually find in your book on page 547. The first image right here is of a normal knee joint. Notice how the space is open. There's no bone-on-bone articulation. That's one of the biggest indicators of a disease process involving the bones or involving the disc spaces or involving the cartilage, the synovial membrane, the bursa, is if you have bone on bone, that means that something is not right in this joint space. So this is a healthy, normal knee. This knee has what's called osteoarthritis. Arthritis, remember, is inflammation of the joint. This is inflammation of the joints in the bony area. And so over here, you notice how it's kind of thickening up the whitish area. When bone is really, really white, that means it's gotten really thick. And then down here is rheumatoid arthritis, and this is due to the rheumatic fever, which not everybody gets, but some people that are older have had that before, and so this causes even more bone on bone. Let's look at some of these diseases and disorders that are built from word parts. We have osteochondritis, which is inflammation of the bone and the cartilage. Osteofibroma is a tumor of the bone and the fibrous tissue that's benign. Osteomalacia is softening of the bone. Osteomyelitis is inflammation of the bone and the muscle, or I'm sorry, the bone marrow. Osteopenia is abnormal reduction of bone mass. This is before osteoporosis. Osteopetrosis, remember, petro is like a stone or hardening, so this is an abnormal condition of hardening of the bones, making them very stone-like or dense. Osteosarcoma is a malignant tumor of the bone, sarcoma. That's a malignant tumor. Polymyositis. Polymyositis. Poly is many, myo is muscle, itis is inflammation. So polymyositis is inflammation of the muscles, multiple muscles. Rachis, am I saying that right? Let me double check. Rachis. Rachis is spina bifida. Spina bifida is where the spine does not fully close as the baby is developing, and so you have portions of the spinal column of the actual spinal cord coming out of the body. They have to have surgery to fix this. Rhabdomyolysis. Rhabdomyolysis is dissolution of the striated muscle. So it's pretty much the muscle starts to kind of break down. Sarcopenia is abnormal reduction of connective tissue. Scoliosis is abnormal condition of a lateral curve of the spine. Spondylarthritis is inflammation of the vertebral joints. Spondylosis is an abnormal condition of the vertebrae where they start to kind of change shape or change position. Synoviosarcoma is a malignant tumor of the synovial membrane. Tendinitis is inflammation of a tendon. And tenosynovitis is inflammation of the tendon and the synovial membrane. The medical term that means softening of bones. Well, we know that softening is malacia, so of these three, it's osteomalacia because osteo is the combining form for bone. Petrosis is hardening, kind of like stone, and then porosis is where it becomes more porous, which is right here. So this is a normal bone, and this is a porotic bone or porosed bone. So it has a large holes as opposed to small ones. So there are quite a bit of diseases and disorders that are not built from word parts. Ankylosing spondylitis, this is a type of arthritis that affects the spine initially. And what it causes is a forward bend of the spine. And so you'll kind of have one piece of the spinal column going over the other. A bunion is an abnormal prominence of the joint at the base of the great toe. This is called the metatarsal phalangeal joint. And what happens is it kind of starts to grow too much, usually from just hereditary conditions or types of shoes that you wear. Another term for it is hallux valgus, and that is in your book on page 553. Carpal tunnel syndrome is a nerve entrapment disorder of the wrist. So this is where the nerves in your wrist are actually entrapped or getting caught in the tunnel because the tunnel has narrowed. Colles fracture is a type of wrist fracture that happens when you fall on your hand. Exostosis is abnormal benign growth on the surface of a bone. It's also called a bone spur. A fracture is abbreviated as FX, and this is just a break in the bone. It could be a complete fracture or a small fracture where the bone is still intact. Gout is a disease where a large amount of uric acid in the blood causes sodium urate crystals to build up in the joints, and it causes arthritis and inflammation like this. Typically, you find it in the big toe. I'm sorry, let me go back. And then a herniated disc is where the intervertebral disc cartilage has ruptured, and parts of the herniated disc, the inside of the disc, it's like a pulpous material. It kind of starts to poke out and push up against the spinal cord. Lyme disease is an infection that occurs from a deer tick bite, and what it does is cause a rash and eventually becomes lots of issues with the musculoskeletal system. Muscular dystrophy is a hereditary disease characterized by degeneration of muscle and weakness. Myasthenia gravis, or MG, is a chronic disease that's characterized by muscle weakness and thought to be caused by a defect in the transmission of impulses from nerve to muscle cells. Osteoporosis, we already talked about this. This is the abnormal loss of bone density. and it leads to lots of fractures, especially in the ribs and your thoracic and lumbar spine and your hips and wrists um, after any kind of trauma, even if it's just a bumping a table. So osteoporosis kind of causes people to just constantly be breaking bones. Plantar fasciitis, this is the inflammation of the plantar fascia. This is the fascia right here. A fascia is a connective tissue that extends across the bottom of the foot, for instance. And so what happens is it's inflamed and it starts to cause a lot of pain. Um, a lot of times it causes pain in your heel. Rheumatoid arthritis. This is a chronic systemic disease. Again, I mentioned that when we were looking at the knee joint. It's an autoimmune inflammatory change, and it causes changes in your connective tissue. Spinal stenosis. Stenosis is narrowing, so this is narrowing of the spinal canal, which causes compression of the nerve roots. Notice how here it's narrowed down so much. And the narrowing is occurring because the bone is growing and narrowing into the actual spinal canal. And this is something that would need to be fixed with surgery. Spondylolisthesis. This is where one portion goes over another. So you have a forward slipping of one vertebra over another. So we do have some terms that we need to know about and what they are typically known. Kyphosis is a medical term that also means hunchback or humpback. So somebody who is kyphotic has a humpback. Lordosis is somebody that has a sway back. So this is lordosis right here, and this is kyphosis. Some people have lordosis, and I like to remember this by thinking of somebody putting their hand on their back and going, oh, Lord. Well, typically when they do that, they're kind of poking their tummy out, and that's what lordosis kind of resembles. And then kyphotic is the humpback, of course. Rachis is the spina bifida condition. Bunion, remember, is that overgrowth of the first toe joint, and it's also called hallux valgus. Exostosis is another term for spur. A bone spur is an excessive growth of the bone. A herniated disc can be known as a slip disc, a ruptured disc, a herniated intervertebral disc, or a herniated nucleus pulposus. And this right here is abbreviated as HNP. This is a diagram of how carpal tunnel occurs. So these are all of the different carpal bones that you have right here, and this is the beginning of your metacarpal bones, which are your palm bones. And so you have this median nerve that branches off into all these other nerves, and it's going through the carpal tunnel of your wrist. And what happens is, because of excessive movement, excessive use, that carpal tunnel will start to narrow, kind of like spinal stenosis, and it will start to kind of pinch at this median nerve and cause a lot of pain, numbness, tingling, inability to use your hand. All right, so it says, which is the affected bone in a Colles fracture? Well, if we look at this image right here, this is your ulna and this is your radius, and so it is the radius bone that is affected by a Colles fracture. What is the anatomic location of the fracture in the bone? Well, the anatomic location would be the distal portion of your radius bone. All right, so spondylolisthesis and spinal stenosis. So remember, spondylolisthesis is where one bone anteriorly displaces over another in the spine. And it causes a lot of different issues. Like, for instance, look at how this intervertebral disc is now kind of compressed, and it's probably causing a lot of pain. Spinal stenosis is where you have this hypertrophy of the facets and the thickened ligamentum flavum. This is a ligament. So hypertrophy is excessive growth. And so the facets are part of the bone, of the vertebral bone. And what happens is they start to excessively grow, and then the ligamentum flavum, the ligament also starts to get thick. And this causes the narrowing of the space. Notice how the space is very wide open, and the ligamentum is very thin. Over here it's very thick, and the space is very narrow. All right, now we know some of these disorders that occur in the musculoskeletal system, so let's talk about the surgical terms. Aponeuropathy. This is the suturing of an aponeurosis. Remember, aponeurosis is that sheet of connective tissue, and so this is the suturing of it because maybe it tore. Arthrocentesis is a surgical puncture to aspirate fluid from the joint. A lot of times this happens when patients have excessive fluid buildup in their joint space. A lot of people say, I have water on my knee. This is what this surgical procedure does, is remove that excessive fluid. Arthrochalasia. I don't think this is in your book. Arthrochalasia is actually where you are breaking the adhesions in an ankylosis to allow more mobility in the joint. So they're forcibly breaking um, the ankylosis of the joint so that we can allow more movement. Arthrodesis is surgical fixation of a joint. It's also called a joint fusion, and they usually do it with pins and rods. Arthroplasty is surgical repair of a joint. Bursectomy is the excision or removal of the bursa. A carpectomy is excision of a carpal bone. Carpal bones are in your wrist. Chondrectomy is the excision of a cartilage. Chondroplasty is the surgical repair of a cartilage. Costectomy is the surgical excision of a rib. Cranioplasty is surgical repair of the skull. Craniotomy is the incision into the cranium for surgery of the brain. So this would be a craniotomy. This is actually a patient's brain right here. They're in the top of the head and they're going into the head, into the brain. A discectomy is the excision of an intervertebral disc, and sometimes it can be spelled with a C, D-I-S-C, instead of D-I-S-K. Laminectomy is the excision of the lamina, which is done because it's pushing up against the nerve roots. Remember, the lamina is part of the vertebral body. Maxillectomy is excision of the maxilla bone or part of the maxilla. Meniscectomy is the excision of a meniscus in the knee. Let's see, the correct spelling of the term meaning surgical puncture to aspirate fluid from a joint. Well, we know centesis is surgical puncture to aspirate fluid. Joint is arthro, so naturally it would be arthrocentesis. All right, let's look at some more of these surgical terms. A myorrhaphy is a suturing of the muscle, myorrhaphy. Ostectomy is the excision of a bone. Ostectomy. Osteoclasis is, again, this is the one that we just said. Patelectomy, excision of a patella. Notice how I'm also having problems pronouncing these words because I don't hear them very often, so it takes a couple of tries before you get it sometimes. Phalangectomy is an excision of a finger or a toe because phalanges are fingers and toes. Rachiotomy is an incision into the vertebral column. Spondylocentesis. Spondylocentesis is fusing together of the vertebra. It's also called a spinal fusion, and sometimes they do this. Sometimes this happens due to surgery or naturally occurring. Synovectomy is the excision of the synovial membrane of a joint. Tarsectomy is the excision of one or more tarsal bones. Tenomyoplasty, surgical repair of the tendon and the muscle. Tenorrhaphy is suturing of a tendon. Vertebroplasty is a surgical repair of a vertebra. This is an image of how a herniated disc looks. Notice how this says herniated nucleus pulposus, which is abbreviated as HNP. So this is the disc, okay? The disc has a nucleus or an internal component that is kind of like a pulpy material. And then it's just a disc space itself. It's got like a membrane. So the inside of it, this will rupture, and the inside of it, the jelly-like fluid that's in there will start to kind of push out and push up against your spinal cord. This yellow portion right here is your actual spinal cord. And so this pulp is pushing up against the spinal cord, causing it to kind of be pinched, and this causes a lot of pain, possibly numbness or tingling in certain parts of the body depending on where it's happening. So for instance, in the lumbar spine, it's probably happening in the legs. This patient's feeling pain or numbness in their legs. And this is kind of a cross-sectional view of it from the top as you're looking down on the spine, and notice how it's just pushing up against a portion of that spinal cord. So to repair this, they perform what's called a discectomy, and they go in and they cut out the portion of the disc that has protruded. So notice how this is that jelly-like fluid inside of the disc itself, and they go in and they just take out a portion of this so that it is no longer pushing up against the spinal cord as much. All right, so we know that there's all these conditions. How do we diagnose them? Well, we use different diagnostic procedures such as arthrography, MRI. An arthrography is an imaging, a radiographic imaging of a joint with contrast media. So what we do is we inject a dye into the joint space, and either using MRI or X-ray, we look at that joint space to determine if there's any tears in the joint space in the bursa or any tendon or ligament tears that may be causing the patient pain. With endoscopies, we can use an arthroscope to perform an arthroscopy where we're actually looking into the knee joint. So this is an arthroscope right here. Notice how they're looking inside of the knee joint. And then another type of study that they use is an electromyogram or an EMG. And this is a record of the electrical activity that occurs in skeletal muscle. So what type of procedure do you see here? They are visually examining the joint. So we know that visual examination is scopy and joint is arthro, so the answer is arthroscopy. Notice that scope is on here too, but scope is the actual tool. Scopy is the process of visually examining something. All right, so the term dystrophy means what? Well, trophy means nourishment or development, and dys is abnormal. So the obvious answer would be abnormal development. Excessive development would be hypertrophy, and then difficult movement. If you know this, then say it out loud. I can't hear you, but you should be able to figure this out. Complementary terms and not built from word parts. So there are multiples of these. This is an example of some type of procedure, a prosthesis. This is the prosthesis. So we are totally replacing the knee joint. What they do is they go in to the knee joint. They actually cut out the distal and proximal portions, the distal portion of the femur, the proximal portion of the tibia, and then they put this prosthetic piece that mimics what a healthy knee joint would do. Some more complementary terms. Chiropodist or podiatrist. This is somebody who is studying the bones, studying the joints. This is what a chiropodist or a podiatrist does. Typically, a podiatrist is going to be, excuse me, somebody who is treating the foot and diagnosing diseases of the foot. Chiropractor. This is a specialist in the practice of chiropractic. Chiropractic is a system of treatment that consists of manipulation of the vertebral column. Crepitus is a crackling sensation that you hear when two bones rub against each other. Orthopedics, or ortho for short, is the branch of medicine dealing with the study and treatment of diseases and abnormalities of the musculoskeletal system. Orthopedist is a physician who specializes in the study and treatment of diseases and abnormalities of the musculoskeletal system. So you have an orthopedist that studies orthopedics. Orthotics are the process of making and fitting orthopedic appliances, such as arch supports to help somebody stand up better or to align their back. Orthotist is a person who specializes in orthotics. An osteoclast is a type of bone cell that's involved in absorption and removal of bone minerals. Remember, we have clasts and blasts. An osteoclast is a bone cell that actually removes things. Osteopath, or DO, is the doctor of osteopath, is a physician who specializes in osteopathy. And osteopathy is a system of medicine that uses the usual forms of diagnosis and treatment, but also puts a bigger emphasis on the relationship between the body organs and the musculoskeletal system. So they're looking at everything instead of just one part of the body. Prosthesis, or plural prostheses, is some type of artificial substitution for either a joint or a missing body part, such as a leg or an eye. A rheumatologist is a physician who specializes in the study and treatment of rheumatic disease, and then rheumatology is the actual study and treatment of rheumatic diseases. So which specialist or specialty will the patient see? Medical management for a chronic rheumatoid arthritic condition of the hip. Well, somebody who is specializing in rheumatoid arthritis is going to be a rheumatologist. And then the surgical treatment for this arthritic hip, which now requires total hip arthroplasty. So a rheumatologist, and the study is rheumatology, and for this one we have an orthopedist, and orthopedics is the study of the joints. This is called a TKA, total knee arthroplasty, okay? Arthroplasty. And so what they're doing is they're going in. Notice how there's a little bit of bone on bone right here. This joint space is not open like it's supposed to be. And so they go in and they fix it by replacing the distal and proximal portions of the tibia and femur. And now the patient has a normal knee joint. If you turn to page 578, these are your abbreviations. C1 through C7 is a cervical spine. CTS is carpal tunnel syndrome. DC is a doctor of chiropractic. DO is a doctor of osteopathy. EMG is an electromyogram. FX, notice how it's lowercase, it's fracture. HNP, herniated nucleus pulposus, that's where the disc is protruding and pushing up against the spine. L1 through L5 is a lumbar vertebrae. MD is a muscular dystrophy. It's also medical doctor, but in this case, it's muscular dystrophy. MG is myasthenia gravis. OA is osteoarthritis. Ortho is orthopedics. RA is rheumatoid arthritis. T1 through T12 is the thoracic vertebrae. And TKA is total knee arthroplasty. There's also THA in your book, which is total hip arthroplasty. The same thing as TKA, but with the hip joint. All right, last portion of this. We are looking at this scenarios. The first scenario is that we have an orthopedist that recommends Mr. Shaw have an arthrodesis to reduce the pain caused from an ankle fracture he sustained several years ago. So, the orthopedist is the doctor who's going to be looking at the joints and looking at your bone, your musculoskeletal system. This patient has a fracture or a break in the bone that he had many years ago. And so it's causing him a lot of pain. And so what the orthopedist is recommending is that he has what's called an arthrodesis, and that is the surgical fixation of a joint or a joint fusion. So they're going to go in and they're going to put pins in his ankle to help the pain. Mrs. Diaz severed a tendon. Severed means that she cut it. She cut a tendon by accidentally walking through glass patio door. So a tenorrhaphy was performed to repair the tendon. This is a surgical suturing of a tendon. And then an electromyogram can assist the physician in diagnosing muscular dystrophy. Atrophy frequently occurs in patients with this disease. So an electromyogram, this is that EMG study where they're measuring the electrical impulses in the muscle, because muscular dystrophy is a disorder where the muscles are not getting the right type of information to grow properly. So this is growing improperly or developing improperly, dystrophy, the abnormal or the lack of proper growth. And then atrophy is no growth whatsoever. So somebody who has muscular dystrophy will eventually develop atrophy. Atrophy is pretty much the dying of or the reduction in size of like a muscle, for instance. And so somebody who has muscular dystrophy will eventually have atrophy of their muscles, and they will start to look very, very small because their muscles have gotten so weak and they're not receiving the nourishment that they need. Muscular dystrophy is where they don't receive that nourishment, and so they're not growing properly, and it reduces their size. So that's the end of your chapter. This, along with chapter 13, is going to be your next test. Chapter 13, remember, is over the ear, and that lecture is also posted. So please make sure you're going over both of these chapters before your test for next class period. And if you have any questions, please contact me. Thank you.